patients and their caregivers. Today we have the renowned gastroenterologist from Agra, Dr. Karan Rawat. Dr. Karan, Dr. Karan Rawat needs no introduction, but however, I would fail my duty if I don't mention that. Dr. Karan Rawat is a leading gastro in Agra, providing a comprehensive and compassionate care to many patients for various gastrointestinal and liver conditions. He has experience building a clinical skill set that allows him to deliver patient-centric care. He is from the Safe and Surgery Gastro Centers in Agra as a senior consultant. Sir, we salute your dedication to spreading awareness related to liver health. So now I invite Dr. Karan Rawat, sir, to spreading awareness on related to liver health. Sir, over to you.
Thank you, everyone. So let's start with this topic today that is known as fatty liver. So the topic of today is fighting fatty liver, NAFLD, non-alcoholic fatty liver disease. As we all know, the liver is the second largest organ of the human body. Its weight is around 1.5 kgs and it is located on the upper right hand portion of the abdominal cavity on the top of the stomach and the intestines. So the language is very clear and everyone can understand what is the where is liver situated. So it's pinkish brown in color, soft in consistency, and highly vascular because it has many of the arteries, arterioles, and the venous systems that get the blood in and out of the liver. So, what are the normal functions of the liver? The functions of the liver are to destroy old RBC, old blood cells, process the nutrition and the nutrients that we have in the food, and then regulates the blood component, that is the heme and the globin component, hemoglobin, and then it produces bile which helps us to digest all the food particles. It produces proteins and cholesterols by a series of complex chains and controls over a 500 metabolic process and breakdowns alcohol and the medications like paracetamol and every other medications that we take, and it detoxifies the blood. So it is the liver that helps in many ways to the body. It's a very important organ, one of the most important organs of the body. So, what is non alcoholic fatty liver disease? It is a condition in which the fat, up more than 5% of the weight of the liver, which is not caused by alcohol use. And if untreated, it will progress into NASH, NASH, what we call. So, I will come to that later on. So, being overweight or obese, having a type 2 diabetes or a high cholesterol are associated with the increased risk of NAFLD. So in India, as we just studied, 1 out of 4 people have this fatty liver disease, and it is regardless of the weight. Someone is very thin but having a fatty liver. So fatty liver is significantly high in number in the Indian subcontinent. More than 6 diabetic or 9 severe obese people out of 10 have this fatty liver disease. So the male gender has been regarded as a risk factor. If you are a male, then yes, you are at risk of non-alcoholic steatohepatitis and the fibrosis. So here it is a very important and a very simple picture depicting from the healthy liver to the last stage, which is known as the cirrhosis. So healthy liver, when there is a deposit of fat and which causes hepatomegaly or the liver enlargement, then it's known as the fatty liver. Then what happens in the time during in the duration of time, scarring over the liver forms and liver cell injury occurs to happen, which is known as liver fibrosis, and then more and more and more scarring day to day, months to months, years on years. So it destroys the liver cell and liver is unable to work properly as well as to rejuvenate or regenerate itself. So, what is the difference between NAFL and NASH? So, NAFL is the fat accumulation in the liver, and NASH, that is steatosis, it is the fat accumulation with visible inflammation and scarring of the liver. The fat accumulation in the liver is also known as steatosis. Steatosis will lead to inflammation of these liver cells, hepatic cells, and it is known as NASH, which is non-alcoholic steatohepatitis. Scarring of the liver on the benign stage is also known as fibrosis. So, what are the causes of this fatty liver disease? Obesity, genetic background. If your parents have the tendency of a fatty liver, or they are obesity or central obesity also, then what is your food intake? If it includes all the chow mein, burger, these fatty acids, unsaturated fatty acids, then yes, definitely you are very prone to this fatty liver. Metabolic syndrome is blood pressure, hypertension, sleep apnea, overweight. BMI is very high. So this also is associated with fatty liver. Certain medication also cause this steatosis, the fat accumulation of the liver. And then yes, physical activity, lack of exercise, not a daily routine, not having a healthy diet, these all constitutes making the liver fatty. So, being overweight or obese causes fat to accumulate in the liver. Obesity increases the amount of fat to constitute 5 to 10%, and this leads to the scarring of the liver and the NASH syndrome. So, what is the association between this fatty liver disease and diabetes mellitus? It is definitely bidirectional. Threefold increased risk of death is due to cirrhosis. So, diabetes and fatty liver are interconnected and having a very strong connection with the increased risk of NASH as well as high prevalence of diabetes. So, there is a 2 to 4 fold increase in developing diabetes with the people who are suffering for fatty liver diseases. So, what are the symptoms of this fatty liver disease? Many people come to the clinic and say कि सर काम करते हैं, एक तो कभी कभार भूख नहीं लगती, शाम को बहुत थकान सी रहती है, उल्टी का मन करता है, सुबह सुबह पेट फूलता रहता है, और वजन भी कम हो रहा है, कभी कभार पैरों में सूजन आ रही है, ये सारी चीजें कहते हैं जो लिवर के पेशेंट्स होते हैं. सो सी NFLD हैज दिस माइल्ड फटीग and discomfort and or the pain in the right upper abdomen, which are the main basic symptoms of this fatty liver disease. And when it turns into the NASH, that is steatosis, steatohepatitis, then there is an increased fatigue, nausea, there is ascites, that is the fluid in the abdomen, confusion due to ammonia buildup, there is a decrease or a loss of appetite, and the patients have tendency to bruise. कोई भी चोट लग जाए तो आपको जल्दी से लालपन या नीलापन आपको आ जाएगा वहां पर, पैरों में सूजन ज्यादा होगी, there is an unexplained weight loss also, and there would be which can be visible jaundice also, that is building up really slowly, which is the yellowish peelapan, yellowish discoloration of the skin and the eyes. And then there are esophageal varices. Sometimes people with NASH uh, vomits out blood, hematomesis, which we call. So how can we identify this fatty liver? By some fluid blood test, ultrasound of the fibroscan, liver biopsy for the pathology, and X-ray, CT, MRI can be helpful also. So most common blood tests are this SGOT and SGOT. So there is a persistent elevated ALT which can be associated with the disease progression, and the normal also ALT level can also develop progressive disease. एंड देर आर अप टू 80%, ऐसा नहीं है कि अगर आपकी नॉर्मल आया तो आपको डिजीज वो नहीं चल रही होगी. बहुत 80% ऑफ द पीपल हैव नॉर्मल ALT लेवल, दैट इज द SGPT लेवल, स्टिल दे आर सफरिंग फ्रॉम दिस फैटी लिवर डिजीज. So there is right now no designated SGPT cutoff for the prediction of NASH or advanced fibrosis of the fatty liver patients. Using these blood tests and various scoring methods have been established, like FIB-4 and NFS-NFLD fibrosis score. As you can see, it has this age, SGOT, SGPT, platelet count level, and then fibrosis score, which would include platelet count, BMI, fasting glucose, and albumin. So these scoring system has been established to diagnose more better than SGPT and SGOT alone. Online tools are available to calculate these score, and you can enter values from your blood report and generate the score. You can yourself do that to understand that. So, what are the investigations, non-invasive, that are helpful for diagnosing a fatty liver? Ultrasound. It is easily available. It is economic. It has reason for most accidental diagnosis of the fatty liver, and then can only detect if fat is greater than 25% and cannot differentiate between a fat and a fibrosis. Another thing is fibroscan, that is known as the transient elastography, which has been boon to the patients suffering from fatty liver disease or the liver pathologies. So it diagnoses a fatty liver with fat greater than 10%. It can differentiate between fibrosis and the fat content, and it is very easy, handy to operate. And then in obesity, sometimes it can give false results, false positive results also, or false negative results. So transient, what is transient liver scans? Transient elastography. It works on the principle of the transient elastography, as we all know. We have two different values, that is liver stiffness measure and control attenuation parameters, LSM and CAP. Please do remember that these two are the things which LSM stiffness indicates the degree of fibrosis in the liver, and CAP indicates the degree of steatosis in the liver. Then in another, there is MRI, that is PDFF, gold standard to detect fat content. It can measure fat content which is greater than only 1% also. It is a widely used technique for the liver donor patient, and but it is not widely available and bit costly. Then there is invasive methods for the liver detection, NASH and NFLD detection. That is the liver biopsy. It is the gold standard for diagnosing these conditions, and it is the only method to diagnose NASH and rule out other liver pathologies. How is it done? It is a there is a small center core of tissue which is removed from the liver by the help of the biopsy needle, which can be USG guided or normally also. USG guided is safer and better. And then it is sent for biopsy, but it is painful. And if the individual wants to do it, then yes, otherwise, some people drop down the ideas. Chances of misdiagnosis in early stages are also commonly seen. Always remember, progression of fatty liver to NASH takes years. Early intervention will always be beneficial. घर से शुरुआत करें, लाइफस्टाइल से शुरुआत करें, अपनी सोच से शुरुआत करें, अपने संयम से शुरुआत करें. NAFLD 7 to 75, 70 to 75% isolated fatty liver. So none to very minimal progression to fibrosis. uh, no risk of death as compared with the general population. But with mild inflammation, yes, probably variability of some risk of progression. And then 25% of the patient which will develop to NASH, NASH will develop to cirrhosis, and then compensated will go into decompensation over the 7 to 10 years. So means it would take around 20 odd years to get up to the decompensation of the liver. But it doesn't happen with every person, every patient. Yes, from the first day, you have to treat yourself with the most utmost attention for your own health. Increased risk of death compared to the general population by the cardiovascular issues, malignancy, and liver related. NASH with fibrosis presents worse prognosis. Uh, then it's always said, act before it's too late. NASH is a more serious form of fatty liver, which in which you have scarring of the liver, and it may lead to cirrhosis or liver cancer. Severe NASH is not reversible. So what can we do? Definitely diet, exercise, lifestyle modification, and then there are some new medications also, which will definitely help you. And you can always talk to the specialist or the doctor about the treatment options. control your weight gain. Combination of a low calorie diet and moderate intensity exercise provide the best likelihood of the sustained weight loss. Weight loss of at least 3 to 5% body weight helps you to improve steatosis. Weight loss of 7 to 10% to improve majority of the histopathological features of NASH, including fibrosis. So weight loss effect of fatty liver is if the weight loss is greater than 10%, then fibrosis, weight loss is greater in NASH resolution, weight loss is greater than 7%. In inflammation, more than 5%, steatosis is more than 3% equal to. What is the diet for the healthy liver? We always have this following of Mediterranean name of the diet, which is weekly moderate portions of poultry, eggs, cheese, dahi, yogurt, and less often red meat or sweets. Then often we can have twice fish or a seafood. Every day it's all about vegetables, fruits, whole wheat, grain, olive oil, legumes, seeds, herbs, and spices. What are the type of exercises like aerobic exercises and resistance exercises? One can reduce the liver fat, other can reduce the liver inflammation, as you can see on the screen. And definitely it will help the fatty liver convert to the normal liver. Uh, what are the lifestyle tips? Yes, regular medical checkups. It's very important in today's 2024 that we are living in. Eat small and frequent meals. Lower your sugar intake. Some doctors have just reduced their sugar intake totally. Get enough sleep. Then develop an exercise routine and stick to it. Get enough vitamins and minerals. So, what are the pharmacological approach? Pharmacological approach is there are various molecules that have come, which are pioglitazone, saroglitazar, and vitamin E. So, saroglitazar in this case is given to NASH with or without fibrosis in both diabetic and non-diabetic patients for 1 year minimum duration, and vitamin E for the 2 years, and the pioglitazone is another for the 2 years. So, tips to prevent fatty liver disease is limit intake of saturated fats and trans fats, quit smoking, exercise regularly, eat a balanced diet, limit consumption of refined carbohydrates, limit or avoid alcohol, maintain a healthy liver, and take medications as prescribed. Thank you. Let's pledge today to have a better lifestyle and have a better liver. Thank you.
Thank you, sir. Thank you for this wonderful talk. Definitely, this has enlightened us. You have explained in English and Hindi, so I definitely sure all the people have definitely understood what you have said. So now we will take the question from our audience with your permission, sir.
Please go ahead. Please, please.
Sir, there is a one question is asked by the most of the people is that, sir, when we have to consult the specialist for this fatty liver disease?
It is very well mentioned in this presentation of mine also. If you are obese, having this right side upper abdomen pain, and then yes, you have started uh, thinking after having all these fatty foods and everything, having not having a good healthy day-to-day lifestyle, and then you seem to think, yes, I am when I come out of the office, I am very tired every evening, then yes, you should consult a doctor, because today I am seeing every other patient suffering from fatty liver, and the early detection is there, the early and massive improvement the patient gets. Everyone needs the right direction at the right time.
There is a one question that already in your presentation. So, sir, you for this now. Sir, heavy emphasis for the liver disease equally important people affected by the liver to regularly visit doctors and continue medication. With careful observation and it is possible to obtain the control of the disease. So I would also like to thank our audience for their active participation and the patience in making this event successful. So stay connected with NASH 24 by 7 on Facebook. Take care of yourself and your family members. Thank you. Thank you, sir.
Thank you so much. Thank you.